Hi, Reg. Good to see you again. We're here to talk about the next question. Where and how and when do we make investments to best reduce the burden of chronic diseases that we just mentioned in the previous interview? And how do we take the burden off acute care?
It's a very good question. Our biggest challenge right now is looking at methods to prevent disease, particularly to prevent chronic disease. And this happens in a non-acute scenario. This happens in community. And what we're beginning to find, not only in Canada, but in the US and around the world, that the role that municipalities can play in driving better health outcomes is something that we're just starting to understand. And that's one of the reasons that Health City has come into fruition. So looking at social services and social programs that we can put in place that are informed by health and assist in terms of driving better health outcomes is a key strategy that we should be deploying. And it's something that we're trying to figure out from a policy perspective. How does that manifest itself in society today?
So can you elaborate a bit on that? Like, what would be a top three potentially that if you had your wish list?
Give me a minute here. Sorry.
That would be in top three, let's say, investments. It could be in kind, or the city could, put forward programs, or the province could put more forward programs,
Sure.
or you could collaborate with somebody from the outside.
Okay, let me give it a whirl and see here.
Okay.
So in terms of investments, there's a few different types of investments that we need to start making that look different. First of all, looking at how to connect social services from the municipality to health. And in many jurisdictions, in Canada, for example, health is a provincial mandate. And so how do we start connecting this, what investments the city is making and what investments the province is making? How do they inform each other, both towards driving better health outcomes? And this is an interesting challenge, and this is where Health City is actually trying to bring data and information to the table so that both the municipalities and the province can make smarter decisions, knowing what each other's investment objectives are.
And then, of course, there's the federal funding, but in healthcare is administered by the province. So how does that enable or help Health City?
So one of the things that the federal government is doing beyond health transfers is also looking at funding innovation in particular spaces. And one of those sectors, of course, is health. Edmonton has applied for a smart city grant from the federal government. And out of 29 applicants, 5 were selected to move forward to the final round. And Edmonton is one of those 5 moving forward. Edmonton's application is around what I just spoke about. How do we combine the intelligence and the investments that are being made at the municipal level to drive better health outcomes?
Are there any examples that come to mind?
So one of the funding programs that the federal government has is the Smart Cities program, which looks at funding cities to drive innovation in particular sectors. What's interesting about that is that the Smart Cities program will look at making investments in cities in different areas. It could be transportation, it could be health, it could be education, but then look to scale those innovations and learnings across the nation.
And then so that's where once that comes to a certain point where there's some outcomes, the private sector can start to collaborate a little bit more clearly then.
Yeah, in this Smart Cities program, it is actually encouraged to have industry and industry investments at the very beginning. It is well known that for innovation to hit the market, you need industry investment and participation.
Excellent. That answers our question very much, Reg. Thanks very much. We'll look forward to our next question on emerging technologies.
Thank you.